You know that feeling, that little creak in your knee, or that dull ache in your hip? It's something pretty much all of us can relate to. But what happens when that ache just doesn't go away? Today, we're diving into the most common reason why and the incredible piece of engineering that can help turn back the clock on joint pain.
So we've all been there, right? That little twinge in your knee, maybe some stiffness in your hip. But have you ever stopped to think, what if that nagging ache is actually the single most common type of arthritis in the entire world? Yeah. Let's dig in and find out what's really going on.
All right, so if we're going to talk about the fix, we first have to understand what's actually broken. Let's get right to it and identify the main culprit behind all this pain.
And here it is. The main culprit is called osteoarthritis, or OA for short. Now, the word you really need to focus on here is degenerative. This isn't just some temporary thing. We're talking about the literal breakdown of the cartilage, that protective cushion that sits on the end of your bones. And once that cushion wears away, well, you get bone grinding on bone. And let me tell you, it is every bit as painful as it sounds.
And the scale of this, it is just staggering. You hear about other types, right? Like rheumatoid arthritis? Well, they barely even show up on the chart in comparison. Osteoarthritis is, by a huge margin, the #1 reason for arthritic pain, especially for anyone over 50. Okay, so we've got our culprit, osteoarthritis. But, like any good detective, we need to figure out its MO. Where does it hit the hardest? Does it just attack all our joints equally? Nope, not even close. All right, here it is. The #1 target, the joint that takes more of a beating from this than any other, is the knee. Hips are definitely up there, a close second. But the knee, that's ground zero for osteoarthritis.
But why? Why the knee specifically? Well, it really just comes down to simple physics. Think about it. Every single step you take, your knees are the main shock absorbers for your entire body. Now, multiply that force by millions and millions of steps over decades, and it's really no surprise that this is the joint that shows the most wear and tear.
Okay, so we know what it is and where it hits. But what happens when the pain gets to be too much? When painkillers and therapy just aren't cutting it anymore? That's when we turn to surgery. But listen, there is a massive misconception out there about what joint replacement actually does.
And this is maybe the most important thing you need to get from this whole explainer. Joint replacement surgery does not cure the arthritis itself. That's not the goal. The goal isn't to get rid of the disease. The real goal is to get rid of the pain and give you your mobility back so you can walk and move and just live your life again.
So a better way to think about it is this. Joint replacement is all about quality of life. We're not curing the underlying condition. We're alleviating the symptoms, the horrible pain, the stiffness, so that people can get back to doing the things they love, whether it's cycling or just being able to play with their grandkids without being in constant agony.
All right, so if you're taking out a worn-out biological part, what in the world do you replace it with? This is where medicine and amazing engineering really come together. Let's take a look inside the implant itself.
So building a new joint is all about finding the perfect materials to work together. For hip replacements, the gold standard for decades has been this specific combo: a polished metal ball that fits into a cup lined with polyethylene, which is basically a super durable kind of plastic. This pairing has been proven, over a long time, to give the best results with the least amount of wear.
And believe me, getting this material choice right is absolutely critical. For a while, there was this trend of using all metal implants, but that's been pretty much abandoned. And why? Well, it turns out they could shed these microscopic metal particles into a person's bloodstream, which, as you can imagine, caused all sorts of other problems. It's just a huge reminder of how important it is to do long-term testing when you're putting something inside the human body for good.
But of course, we have to talk about the other side of the coin. No major surgery is ever completely risk-free. So to make a good decision, you have to weigh the incredible benefits against the potential downsides. Let's take a clear-eyed look at what those are.
So, out of all the things that could potentially go wrong, what's the one thing that keeps surgeons and patients up at night? It's probably not what you'd guess. The most common serious risk is getting an infection right there at the surgical site.
Okay, so let's say an infection does happen. It's almost always located right where the surgery was. The good news is doctors have a very clear playbook for this. Often it can be handled with some powerful antibiotics, but sometimes they might have to go back in for another procedure to basically wash out the joint and get rid of that bacteria for good.
So it really is all about putting these risks into perspective. While any infection is a serious thing, you have to remember that the chances of something truly catastrophic happening, like a heart attack or a stroke because of the surgery, are thankfully very, very low. The main focus is really on preventing and managing that localized infection.
So there you have it. We've gone from the slow, painful grind of osteoarthritis all the way to a piece of polished metal and plastic that can literally give someone their life back. It's a pretty incredible story of medical progress, isn't it? But it also gets you thinking. With materials getting stronger and surgical techniques getting more precise, where does this go next? Are we heading toward a future where our joints aren't even limited by our own biology? What happens when the replacement part is actually better than the original? That's definitely something to think about.